Good evening, everyone. Today we are again here with the session of IMKTA Nursery Teachers Training, KIDZINNIA branch, Pune. And today we are going to cover very interesting topic with different type of children uh, about whom the teachers must know before the teacher gets into this job field. And just a minute, two people are trying to enter the room. And allow them to enter. Okay, Swapna and Sneha. Welcome, Swapna and Sneha, to the class. So today we are going to take a new topic. I'd like to share you my screen so that you all can. Sneha, recording is going on, so you can put your video off if you want.
Okay, ma'am.
I'd like to disable screen share. Screen share. My screen. So I'd like to minimize it and open this TV visual disability. Yes. So we are going to start with visual disability. We have already taken a short note about this, that there are some children in the class who face visual difficulty in the classroom, but there are varieties in this group as well. So visual disability and auditory disability we would like to cover today. If we will get time, we will go on mental retarded children. So first we will start with visual disability. As with the term, you all can understand that the child is unable to see to certain extent or totally visual impaired children. So such group of children are known as visual disabled children, and these children can have visual acuity of 20 feet to 200 feet. It means if a normal person can see 200 feet distance, this group of children with visual disability can see 20 feet or less in the better eye, even with correction. Means with the help of aids and with the help of treatment also, they cannot see more than 20 feet. And a partially visual disabled person has visual acuity between 20 to 70 to 20 to 200 feet. Means if a normal person can see 20 feet, 70 feet, this partial visual disabled children can see 20 feet. And if normal people can see up to 200 feet, these children can only see 20 feet. So they can come in partial visual disability. So what are the symptoms that we understand that the child is going towards this stage of their life, his or her life? So first we will see that the child is shrinking eyelids like this. The picture is shared with you. And it starts first with the rubbing of eyes. Multiple times in the class, the child will rub eye. When you will tell to see the board, the child will rub eye. When you will ask, is it visible to you? The child will do squinting or all these things the child will do. So we have to take into note why the child is doing all these things. Tilts head or thrust head forward to see better. Like if you will show some teaching it, the child will do like this. Project his head in nearest to the teaching aid. The child experience difficulty in reading. Means some of the letters are not totally visible to such children. So they will put their book nearer to their face, or they will try to adjust the book so that they can read it. They blink eyes multiple times in a minute. They complain of pain, dizziness, nausea while doing close work. If they have a problem in and they have reading glasses, they will feel giddiness if the textbook will be nearer to them. So and they every time holds the thing nearer to their eyes, and they feel difficulty to see distant thing. If you will ask what is written on the board, they will themselves not understand what the teacher is asking, because the child is not able to see anything in a totally visual condition, a disability condition. So the child will be blank. He or she will not respond what the teacher is asking. So in such case, we as a teacher need to go near to the child and ask, child, can you see the board? If child says yes, I can see, then you can put up another question. So can you read the first line what I have written on the board, or first alphabet what I have written on the board? If the child can see it, the child will definitely answer. But if the child is not answering, there may be many reasons behind it. So we need to be so polite with children in the beginning when we enter the classroom in the beginning of the session, because it takes months to understand children different things. So first day we cannot tell that the child is not answering. I don't know whether the child has learned ABCD in previous class or not. All these things, these query come in the mind of every teacher. But we have to put our queries aside and we have to focus to understand the child's condition first. And they squint eyelid together like this, the girl is doing. They get confused in identify letters or same shape. What they do many a times, children those who have visual problem, they write D opposite, B opposite, C they will write opposite. They cannot identify the difference between the curves mode, which side we should write that it will be correct one. So we need to help those children. Their eyes may be reddish, swollen, or eyelid can have crust deposit on it. Their water discharge can happen in their eyes. Many a times they need to wipe their eyes during the class. And cross-eyed, this picture is called cross-eyed. The child sees like this many a time. Why? Because child is helping herself or himself to cope up with that situation. Why am I unable to see things? So the child does like this, and the child changes the angles many a times. The child many a times it is by birth like this crossed eye. So if the child is having crossed eye, definitely the child will face visual problem, because the lens focus will not be in the straight path. So the child will face problem. So we have to understand as a very humble and very helpful teacher the condition of the children, because their language is also not grown well in preschool. If they face some problem, such a problem, they cannot convey like we convey everything to each other. So that communication level grows gradually between the teacher and the children. So more patience is required in such case. Now, what are the help preschool teachers can provide to such children? Teacher can stimulate other senses to manage understanding about things. This we had discussed in previous class, that for taste and for fragrance, or for such EVS topic which is related to environmental study, or we need to teach them numbers. So we need to help them to touch and feel the things, and then we should teach. If we are teaching number 3, we cannot write on the board because the child is unable to see. So how we will teach them number 3? We will give 3 balls in their hand, and by holding their hand we can say this is 1, 2 and 3, Like this number concept can be developed in preschool. If the child is totally blind or visually disabled, the child will, you need to convey to the parents, go for checkup. If it is found that yes, child is suffering with this condition and this condition is naturally developed in the child, so parents and teachers together need to take decision to put the child in blind school, where they will have different techniques, different methodologies, and differently trained teachers to teach them. So we as a teacher has this duty also to not spoil a single month of such children. If we find some symptoms of all these things, we need to convey to the parents. And difficulty in posture learning, because the child cannot see, so or partial visual disability children we can talk here, because totally visual difficulty children, they have differently trained teacher. So for you as preschooler, where the children can see partially, how we can handle them. So for them we can tell use of touch, feel, fingers for posture learning. Like if I want to teach the child, you need to sit straight. The child doesn't understand what is the meaning of straight, because the child have never seen such people sitting straight like this. Or if the child has seen sometimes at home very closely to their parent, in such case also the child many a times does not understand that this posture is meant for me to sit in the classroom. So how we will teach such children? We will use our palm, put on their backbone. We need to correct the posture like this, and then press the backbone and tell child this is a straight sitting posture. So whenever I call this word straight, children sit straight, and at that time you need to put your back straight. So this is how the teacher helps the children with different movement and touch and feel methodology. The teacher can train daily self-management like eating, bathing. Anyhow, the teacher don't teach in Indian scenario. However, there are many schools in which the children come just after sleeping, and every morning routine like Mercedes Benz. Morning routine and everything have been inculcated by the school. So it is for exceptional schools, not for every school. But eating habit, we can tell them to child at the time of eating, you can sit straight. Then we need to hold their hand and we need to tell that you have to take the spoon like this. What will be the angle of the spoon? Many a times the food spills from such children hand because they do not understand. So we need to hold their hand, put the spoon like this, hold it like this, and one or two times we need to teach them the posture to hold the spoon correctly, and then the child understands. We need to use touch sense for many communication. Like two examples I have given: to sit straight and hold your spoon well, like this. So verbal instruction will not go with such children. We need to use other senses also. Train direction. How we will train such children the direction, because the child is seeing everything blurry. The child is not able to understand partially visible disability. Children also cannot know which direction I'm sitting, where to go. So we need to help them to provide the child with a stick, and with that stick, you need to train them to count the steps. 1, 2, 3. So in the beginning of the classroom, we need to train them how many steps you take from the door to right of your right and left. How we'll teach? Using the hand. First day, the child will not understand this is my right hand. The child can understand this is right because nobody has taught it to the child. So we need to hold hand and tell child this is your right hand. And whenever I will give you instruction, count 10 steps from your place right. So you need to move this side. So this type of training teacher needs to give to the children. Taste food to understand taste buds function. So different type of food. When children nowadays there are options that home food or school food, but in some of the schools it is compulsion to have school food, because both the parents are working, so they opt for school food. So in such case we need to help them to develop the taste. Suppose someday they are getting khichdi, so child taste one spoon. This taste is called salty. Khichdi is salty. So do you like it? Gradually and slowly the child opens up with the teacher, and until and unless the communication is healthy between teacher and student, learning it doesn't start. So what we have to do first, focus in preschool. The teacher has to put on good communication and bonding with the child for learning things. So these are the ways through which we can grow a bonding with the student, and then the child opens up and speaks many things. So smell senses can be used to identify spices and flowers. If we are teaching them food, what is chili, what is turmeric, all these we can teach them by using other senses. Touch, count, and listening sense can be used to play music using percussion instruments. So how we can teach them many a times holding the object and doing it. It is very difficult for children to means if the count is till number 50, so we need to put 50 things for such children. It is difficult for them to arrange it on the desk and all these things. So with the help of percussion instrument we can teach them counting 1, 2, 3, and with the help of clapping also. So instrument, why it is given? Because music is a very good idea to teach concepts. Children love instruments, different type of instruments. So those who are visually partial, visually disabled, they it is said that when God takes one sense, that one of the five senses, the God definitely gives sixth sense to such children. So they have different interest in music as well. So their interest we need to find out, and we need to provide such instrument. Percussion instrument means tabla or congo or drum, like this we can help them. And for pleasant listening and for making their mood light, delighted enough to sit in the classroom and learn. Flute also we can provide, many children learn. So these are the things which when we were in Sunbeam teaching in Banaras, very good thing I experienced there, that in the beginning of the class, means in the beginning of the school, just after prayer, they used to have their LTA, leisure time activity, because the morning should start so definitely for the children, or so lovingly for the children, that they kickstart themselves to learn all abstract concepts. So they used to have a leisure time activity period in the beginning before every other concept class. So those who want to go for dance class, they used to go to dance. Those who want to go for musical, instrumental, vocal, those who want to go for painting. So like that, there were different types of classes, and children need to put the form before it, before the session. And when the session starts, it starts with such classes. So this is how school is working towards nurturing the children in many, many good ways. And uh, it gives immense pleasure to see that actually educational institutions are working for nurturing good human being around the country. So this is how a teacher can help a child. It is very humble, and this job is actually, when we will not see the salary part, and we will see the blessing part. Only the blessed people get this job, because this job needs patience. This job needs connection with human soul, not human personality only, but soul. And this is the job that helps the human culture to grow. So, not every time money, but many a times the output that we see, that due to my presence, my 5 children have improved such in such a way that the child gets to see his or her life differently and very in a very special manner. That feeling is all the return a teacher needs to get. So this is how we handle this different type of children in the classroom. So there are criteria of auditory disability. Mild auditory is 20 to 40. Just a minute. I was teaching visual one and visual is finished. Visual disabled children, this all topic is covered. I will take a pause for 5 minutes. If you have any query regarding this visual disability, you can just ask so that I can go switch on to auditory disability. It doesn't seem good, only I'm speaking and nobody is speaking from that side. So it seems that whether are you all listening to me or I'm speaking only.
No, ma'am, listening.
Okay. So any query regarding all these things? I had some children in my class, but they were partially visual disabled children, those who were facing these problem, and we used to help them in such a manner. The children used to feel very loved when we show such gestures for them, and they learn, but they learn as per their interest level. They learn as per their ability also. So there is no comparison between any of the student in the classroom. So every child is especially curated by the especially made by the Almighty, and every student has specially curated a story, life story, and a life journey to lead. So we have to always keep in mind that comparison should not come among all these children. Then you will only enjoy teaching and all these experiences. So should I switch on auditory disability?
Yes, ma'am.
Yes,
Okay,
ma'am.
fine.
Yes,
Thank
ma'am.
you. So auditory disability means decibel. This is the unit in which we count the sound. So mild auditory loss is between 20 to 40 decibel, and moderate one 40 to 60 decibel. Severe auditory loss means 60 to 80 decibel, and profound means more than 80 or above. So many a times in normal classroom, these mild auditory and moderate auditory loss children can come. But severe one, they again go to special school. But it is again the choice, and it is again the acceptance by teacher and parent to understand whether the child is facing this disability or not. First, it takes years to identify with many parents, but most of the parents, those who are very observant with their children, they quickly catch that my child is facing this problem, and they do not want to waste a single year of their children, so they work behind it. So why this hearing loss happens in the children? There may be history of hearing impairment in the family, and this consanguineous marriages. Consanguineous marriages means if we will marry in same gotra. This is the rule in Hindu tradition also, that in Sanatan tradition, that do not marry in same gotra. And same thing happens in different religion as well. It is proved scientifically that if marriage happens in same genes genetical family, then these genetic disorders may also carry forward to the children. That's why this rule has been made in religion to safeguard the people uh, uh, to face all genetics, whatever health issues are there. So blood group complications also may result in hearing loss, like negative blood group. If both the parents are having negative, or one has negative and another has positive, so it can also affect the hearing loss. Infectious disease contracted by the mother during first trimester of pregnancy. If some diseases happen to this mother, like what type of diseases mother can suffer so that the child gets hearing loss. These are rashes with fever, mumps, or infectious diseases, measles. So if it is severe in the pregnant woman, it can the infection can lead to some hearing loss. The medical point of thing, I do not know. Only the pointers I can explain you. If I will go deep, I need to just contact the doctor for this topic. So this much we need to just understand, that the child is himself or herself not uh, this means not having this quality. It is having a long history behind it. Why we are explaining it to the trainees? So that the trainee can have compassion while handling such children, that the child cannot do anything, it is not in his locus of control. So poor health of expected mother. If mother is not properly fed, mother has gone through many mental trauma, or mother has some genetical history that mother is carrying during the time of pregnancy. So this can happen. Excessive intake of alcohol and nicotine by pregnant women, and that's why doctor suggests not to do anything, because this condition may lead many nervous system related issues in the children, and hearing loss can also have one of them. Unprescribed intake of antibiotic by would-be mother. So whenever would-be mother is there, and sometime some like some fever happens, and mother understands no need to go to doctor, we can take paracetamol. But if we are not pregnant, it's okay, we can play with our body. But if we are pregnant, a child is with us under the womb, we cannot take such risk, and without doctor's prescription we should not take any type of medicine, uh, because the child may suffer with such condition. Exposure to x-ray during pregnancy. So in mama's time, my mother's means previous generation, x-ray was having only 2 times during 9 months pregnancy. But nowadays, every month or 2 months, doctor suggests this ultrasound. So if there is no complications, you can ask and raise this query that doctor, x-ray is not good for health of the baby, as we have learned in our training, or we have learned in our courses. So if it is not necessary, can we please avoid it? We can at least say and see what doctor is saying. So she reduces the this if there is no complication. If we says so. So we need to keep in mind all these things, so that we also do not have some children, those who will face some difficulties due to our all these things, because we are also a mother as well, and we may not I, but some of you, those who want to conceive a second time, they can also be yeah, cautious about all these things. Now, during the birth, what happens that the child faces this disability? Premature delivery. So this is how the doctor suggests not to do excessive physical exercise during pregnancy, whatever is required. More than that, if you will do, premature delivery happens, and due to that, hearing loss can happen in the children. And lack of oxygen to the infant during delivery. Many a times during delivery, the mother is not feeling well, suffocated the mother is feeling, and the hospital people, they cannot identify why the mother is doing so, and they do not provide oxygen mask, and due to that also it happens with the child. Low birth weight of child. If the child is underweight at the time of birth, then again it can happen. Delivery using instrument that can cause damage to auditory cortex in temporal lobe. This is the lobe in which auditory cortex is, this red part is called auditory cortex. If the instrument, any instrument that doctor is using at the time of scissor or at the time of normal delivery, they use some instrument, clutching instrument, and by mistake if it is get poked in the brain and this part is touched by mistake, then again hearing loss happens due to such incident. So we need to take care of it. However, doctors are very much trained in Pune. It doesn't happen due to doctor, but other things we need to keep in mind, that it doesn't happen with any of the children due to our things or our gestures. Now, after birth, what happens that the child can have hearing loss, jaundice, high fever, or convulsions immediately after birth. High fever is also called convulsions, means fluctuations in their temperature. It also result in hearing loss. Infectious diseases like mumps, measles, syphilis. I'm so sorry, I have not means studied about this syphilis disease, so I cannot explain. In next class, I'll try to do it. It just slipped from my mind to study about this. And brain fever, TB, all these things, when these disease happens, again the child can have hearing loss. Intake of antibiotics for a long duration. This is said that do not give antibiotics for many days to infants because it has side effect. So if it is not necessary, avoid giving it. Ask your doctor. Doctor giving so much antibiotic may result in hearing loss. So should we give this much hard or this much dosage? You ask your doctor, because many a times doctors are also human being. Many a times they forget that antibiotic may result in hearing loss also, and different child's body react differently to different medicines. So as a parent, we need to just give a reminder to the parents. If anybody has the history in the family, that parent must tell the doctor that I have hearing loss history in the family. So is it good to give them antibiotic? The doctors definitely listen and they work accordingly. Injury to the ear due to sharp object penetration, that I have already explained in at the time of delivery. But after this, if some children are poking pencil inside the ear, or they take some sharp object and they do something inside the ear, we need to tell them to be aware and not to do it. Exposure to loud sounds, so big these amplifiers have been put in different festivals. So try not to put your child nearby the amplifiers. Make them shift them away from that, so that their this eardrum are very tender in when they are small in age. So it gets hardened in the course of time. So we need to take care of that. High blood pressure or diabetes, tumor in ears, or neglected ear discharge, aging. These all are factors that can affect the hearing loss of individual. And this is the picture of ruptured eardrum that happens due to loud noise as well, due to poking something as well, any of these causes. Signs to be noticed by parents and teachers. If the ear is having this type of discharge, it is not good symptom. Either it is ear infection, or it is damaging ear walls or ruptured eardrums. So we need to take care as a teacher. If some child is having, kindly see the doctor. This note we can give to the, kindly see the ENT. This note we can give to the parents. Frequent cold and sore throat can also be resulted in that. Fluid runs from ears, child does not follow simple instruction, needs repetition of speech. If you will tell child, sit down, and the child is not sitting. Next, third, fourth, fifth instruction if you are giving, and still the child is not sitting, then you need to confirm whether the child is listening or the child does it after listening. There is some other issue with the child. So we need to work on behind the children. And the child doesn't speak properly at 2 years or slow speech development. In some of the children, we see that the child is not speaking. At that time also, we need to confirm whether the child is listening. Then the child will start speaking. Listening is the first stage towards learning the language. The child is not listening, the child will not grasp the word, and the child will not identify what thing is what. So the child will not speak. So this is also one of the symptoms. Uses only gesture to communicate. Many children, they do not want to speak only many a times, and they do if they do like this, then also you need to check about auditory things. Tunes TV or radio louder, or the child needs your louder explanation. Wandering of attention means whatever you are seeing, the child is putting like this, projecting the ears like this, I'm not listening, or showing the gestures, and the child faces difficulty in progressing like others in group. So if a child's progress is also being affected, so some of the senses may be not working due to what the child is not progressing. These are the symptoms that parent and teachers can notice to identify this disability. And this is 1 minute is showing to close. So I'm closing it, and after 5 minutes, we will join for 15 minutes, not more than that. 1 hour session is there only, not more than that. So please go and stop sharing it. Rejoin with another link in 5 minutes. Thank you.
Okay.